Hello, now I am going to discuss about some basic things of ECG. ECG is the graphical representation of the electrical activity of heart. If we draw a diagram of the ECG, it has some waves. It will be currently like this. It is started by P wave that determines the atrial contraction, followed by it is the negative deflection Q wave, positive deflection is R wave, and followed by negative deflection S wave, and this is D wave, and this is sometime it comes, this is U wave. P wave, the atrial contraction, followed by starting of the P to starting of the R is the PR interval. It determines the time takes the rhythm to come from SA node to AV node and including AV nodal delay. Then Q, R, and S, these three waves makes the A complex QRS complex. QRS complex determines the ventricular contraction, and followed by T wave uh, determines the ventricular relaxation, and in between this is the ST segment, and ST segment determines the time between ventricular contraction and ventricular relaxation, and sometime this U wave is seen. U wave is best seen in B1 and B3 due to delay of uh, repolarization of Purkinje fiber, and after potential result from mechanical force ventilation, it is seen. U wave is prominent if it is more than 1 to 2 millimeter or 20%, 25% height of T wave. Now I am discussing about how the electric rhythm conducted through heart. Electrical, when heart is contracted, and this rhythm is generated from SA node, and this comes to AV node, and some AV nodal delay occurs there, and then it comes through bundle of his, and from bundle of his it comes via two Purkinje fibers. It is divided into two ventricles, and it contracts two ventricles. Thank you.